Okay, so our today's lecture is gonna be on data extraction. Okay, so I have checked your screening thing. It was like really amazing work, but some mistakes which I noted were I told you people that cohort studies are of two types. Either they are retrospective cohort studies or prospective cohort studies. So wherever you see these retrospective and prospective words, it means these are either observational or cohort studies, right? The next thing is, I told you people that you have to include just the main chunk of RCTs, right? Like you don't have to include the protocol of randomized control trials, the pre-specified analysis of randomized control trials, and other stuff like this. But you people included this. So the rest screening was like good. Huh, okay, the next problem which I noted was stick to your PICO, stick to your patient population, stick to your intervention and control. If you have solid control, then do look both for intervention and control. If you don't have any solid control, then don't look for a control, just look for your intervention, patient population, and study design. In study design, if you have RCTs, randomized control trials, then don't include the cohort retrospective and prospective things. If you have both cohort studies like observational studies and RCTs included in your meta-analysis, then you people are supposed to exclude the reviews thing, meta-analysis things, case controls things, case series, and stuff like this. Protocols of randomized control trials, specified analysis of randomized control trials. So, it was a bit about the last lectures and the mistakes I noted. Okay, one mishap we are having, Trayan is changed to paid version. Like we can't invite collaborators with us to do screening. Before this, like we use 10 or 15 members used to do screening together. So now we can't do this thing. Maybe the issue is rectified. That's why I didn't allow you people to like a single Rayan review and like you didn't do screening collectively. So yeah. Now moving on towards our data extraction thing. Data extraction means that now you have to extract some variables from your meta-analysis, like your outcomes from the meta-analysis. And based on those variables, you people are supposed to do the analysis of those outcomes, and based on that analysis, you people are supposed to write the results, and from that results we write the conclusion of a specific drug or a specific therapy. So this is data extraction. Now, before we move on towards our data extraction, there are some terms which you need to understand. The first thing is what is baseline data. So, guys, give me just 2 minutes. Okay. So baseline data means the data of patients before we intervene, or demographics of patients, or clinical characteristics of patients before our intervention. It means what is the demographic of patients, or what is the real condition of patients before we do any intervention, before the start of clinical trial or any interventional study like cohort studies. So I'll be teaching this through an example, but first focus on this: the data of patients before we intervene, or demographics of patients simply, or we can say clinical characteristics of patients or clinical picture of the patients before we give any drug or before we give any surgical intervention to the patients. You know, surgical intervention or drugs, in a sense that what is our intervention and control. So for example, age of the patients is baseline data, gender is baseline data, race is baseline data, body mass index is baseline data. Hypertension. Now, hypertension, in a sense, right, before we give intervention, is the patient hypertensive or not? So, this is baseline. Is the patient having diabetes or not? Is the patient having any heart disease or not? Let's say, again, I'd stick to the example of metformin in diabetes type 2. So, sorry. In this example, the baseline data of the patient, like I'm assessing the efficacy or safety of metformin in patients with having diabetes type 2. So yeah, diabetes is our baseline data. They are all already having diabetes. But along with diabetes, are they having, or is the patient having any other comorbidities? So it will come under the category of baseline data. The same ways goes for the demographic characteristics of patient. For example, the age, gender, race, BMI, ethnicity, weight, height, etc. So now I gave a touch to baseline data or table 1 in our previous lecture, but if we come to this article again, early metformin in gestational diabetes, right? A randomized controlled trial. Now, we are assessing metformin in gestational diabetes, and our study design is a randomized controlled trial. I hope till now you people should have understood what is randomized controlled trial. Still, I'm saying you'll understand the different study designs once I'm like teaching you people the quality assessment thing. So, when I come to table one is always baseline data. Remember this thing. If I come to table 1, it is see maternal characteristics at wetline. See, our patient population is those having gestational diabetes. So maternal characteristics or the characteristics of that pregnant lady at baseline before we have given any metformin or placebo. So or also like baseline data can come under different names. It can be maternal characteristics, it can be demographic characteristics, it can be clinical characteristics. All these refers to baseline data. Now, age. See, age is a baseline data. Race, racial or ethnic group is a baseline data. Under ethnic group, then they have specified African, Asian, Irish, white, others. Education level, highest level of education or education level is the baseline data. We know in hospital setting, we call it history. Simply, it is history of patient. In history section, we also take our first section is of demographic, so it is the same demographic. Yeah, so in receipt medical record or okay, this is past medical history or past history. Past history or comorbidity refers to the same thing. Is the patient having any smoking history? Is the patient having any prior hypertension, nulliparous, cesarean delivery, gestational diabetes? Gestational diabetes now refers to our patient population. But here the baseline data refers, is the patient having any or did the patient have any gestational diabetes in the previous pregnancies? Yeah. Postpartum hemorrhage, preeclampsia, so infant with congenital anomalies. So it all comes under the category of baseline data. Let me read the comments. Okay, yes. So is it clear up till now? Guys, please open up your mics and tell me. Is it?
Yes.
I can't I'm sorry, I can't read the comments.
Yes, ma'am.
Oh, okay. So this was all about baseline. Now, how you people can find the baseline data? The first thing is baseline data is always present in table 1, right? The next thing, once you go, okay, this is our article. In article, our first section is title. The next section, this in a brown box is abstract or summary of the whole study. After this, we are having introduction. This whole is introduction, right? After introduction, we have method section. After method section, we have in method section like there are different categories: trial design, trial procedure, outcomes. What are our outcomes? I'll be coming towards the outcomes. Statistical analysis, and then comes the results section. After results, we are having discussion. This whole pattern will be followed by meta-analysis too. Okay, so the first thing, baseline data is always present in table 1. The next, baseline data is always present in the first paragraph of results section. See, from June 2017 to September 2022, these many patients were screened. In the first line, they are explaining this flow diagram. Okay, see, in first lines of the first paragraph, they explained this flow diagram, and in the last line of first paragraph, they came under this. At randomization, maternal characteristics were similar between two groups. So from here, they directed us that in table 1, maternal characteristics are given. From here, you people will find the baseline data. Okay, now coming towards the outcomes. What are outcomes? Hmm. Outcomes mean the results of our intervention. Okay, we give a certain drug or a certain therapy to patients. Now, what is the effect of that particular drug or therapy on our body refers as outcomes. So, the results of our intervention. For example, we give metformin. Okay, so now what are the effects of metformin? Sorry for the spelling mistake. What are the effects of metformin on the body? Like, for example, what are the function of metformin? Metformin can like have effect on our weight. It can increase our weight or it can decrease our weight. It's just a hypothetical thing here what I have written. So weight reduction, let's say decrease in fasting plasma glucose level, abdominal pain, rash, diarrhea. These all are the outcomes or the results of our intervention. So this thing refers to outcomes. Now there are two types of outcomes. I'll show this in our article now, but for now, just focus on this. There are two types of outcomes basically. There can be efficacy outcomes and there can be safety outcomes. Efficacy outcomes means what is the efficacy of drug. You all have like studied pharmacology, so you people will know what is the efficacy and safety profile of a drug. So efficacy outcomes refers to what is the main function of a specific intervention or what is the main like work of a specific drug. So the main work of specific drug will come under the efficacy outcomes. And what are the safety outcomes? Safety outcome means the safety profile or the adverse events which are associated with a specific therapy, right? For example, again, if I refer to metformin, so metformin is a hypoglycemic drug. Its efficacy will be reduction in our blood glucose level. So, if we refer blood glucose level reduction in blood glucose level as an outcome, so this blood glucose level will come under the category of efficacy outcome. Now, what can be the adverse events of a drug? See, events are associated with every type of drugs. So if I say that metformin is causing diarrhea, it is causing rash, it is causing vomiting, it is causing abdominal cramps, it is causing like neurological symptoms, so it will come under the safety profile of the drug. Or adverse events, safety profile or safety outcomes, adverse events, these refer to the same thing. All these terms refer to the same thing, safety outcomes. Okay. Now, if I come to my article, where will you find outcomes? In the method section and in the result section, you will find outcomes. Basically, in the method section, they have explained their study. That what is the study procedure, what is the trial design, let's say what is the trial study design or oversight, how they have performed the statistical analysis, what are their outcomes. So yeah, now outcomes can be categorized in two ways. The safety and efficacy thing which I told is on the basis of function of a drug, like the safety profile of a drug and the efficacy profile of a drug. Now, in studies, in trials, or in in researches, the outcomes are classified as primary outcomes or secondary outcomes. Primary outcomes refers to the main outcomes in the study, which are the most important outcomes of a study, like which are most important to us. The results which are most important to us, which we are assessing, are the primary outcomes or the primary results, and secondary results refers to the other types of outcomes which are not like that much important to us. Even in meta, we'll be classifying outcomes on the basis of either primary or secondary or safety and efficacy, but mostly in metas we do on the basis of primary and secondary. And we decide these primary and secondary outcomes according to our own will. For example, like if I'm assessing the, let's say, endovascular thrombectomy in um, anterior occlusion stroke. So let's say I have different type of outcomes in neurology, like let's say I have outcomes of um, MRS score. You people may know what is MRS score. I have like this outcome, MRS score. I have outcomes like dizziness, vomiting, rash, coma, death. Now, if I'm conducting this meta-analysis, or if I'm conducting meta-analysis on this specific topic, I'll take MRS score is my primary outcome, and the rest will come under the secondary outcome category. So this was all about the primary and secondary outcomes. I'll find the outcomes in this method section. In method section, they would have written about their outcomes. See, the primary outcomes determined at the time of infant delivery was composite of insulin initiation or a fasting laboratory blood glucose level of 5.1 millimole per liter or greater at 32 or 38 weeks of gestation. So this is my primary outcome. Now that I have explained a bit about their primary outcome. Secondary outcomes. Secondary outcomes included infant birth weight, length, head circumference with etc. etc. Macrosomia and all this. Okay, neonatal morbidities. If you people read this paragraph, they would have respiratory distress requiring respiratory support, jaundice, major congenital adverse congenital anomalies. So these all are now the secondary outcomes of metformin. Understood? Okay. So here they have just written in the method section. They would have written only about their outcomes. What are their outcomes? But now, what are the values of outcomes? What we will be extracting, we can find after, like, maybe table 1 and table 2 are both given to baseline characteristics, but in most articles table 1 is for um, baseline characteristics and table 2 is for outcomes. See, they have said in the method section that our primary outcome was initiation of insulin and fasting plasma glucose. Now here they have written the values. This all we will be extracting. Okay. Okay, now next thing, we'll find outcomes in the tables. If any outcome is written in the method section, but its value is not reported in tables. For example, let's say in the method section, it was written, let's suppose they have written jaundice as an outcome, but they have like analyzed jaundice, but its value is not, I can't see its value here in the outcome section. I can't see any values here. So what I'll do, I'll read the result section. In the result section, basically they have explained these outcomes. They would have explained all this, all these tables. In the first table, they would have explained the baseline characteristics, and in the next, they would have explained the outcomes. So then, if value of a particular outcome is not given in the tables, you don't have to skip. You have to first read the result section. If it's not reported in the result section, then what you have to do, you have to go to the supplementary files. See, if an article is too big, then they don't give the whole data in the main primary article. They give some of the data in the supplementary content or the additional content. For example, if we have a lot of outcomes in this study, let's say, and three or we are like the study is required to make 3 or 4 tables. So like the journal usually, like, they don't allow giving 3 or 4 or 5 6 tables, like too many figures in the primary study. So what the journals do, they basically shift some of the outcomes to, or some of the tables to the supplementary content. So you have to go to the supplementary content. You can find supplementary content okay, here in the at the end of article, that have a given supplementary content. See, supplementary, a more complete list of neonatal morbidities is given in table 2 in supplementary table 2. So if I click this, you'll be directed towards another file. So before skipping any outcome in your outcome extraction, make sure you read the result section, you read the supplementary content. If it is not reported in either the tables, the result section, and supplementary file, then you people are supposed to write not reported. Okay. So now the next thing is, it's clear up till now? Guys, quickly tell me, is it clear?
Yes, ma'am.
Okay. Now,
Yes.
the other terminology is there are 2 types of variables basically. We have dichotomous variables and we have continuous variables. What are dichotomous variables? Dichotomous variables is a categorical variable, or dichotomous variable is also referred as binary variables, that has only 2 possible values, or there are only 2 possibilities in dichotomous variables. For example, if, let's say, death is an outcome or death is a variable, then there are just 2 possibilities. Either the person will be alive or the person will be dead. I don't have any range in between the death and live thing. Okay, so Death is dichotomous variable. I am having only yes or no option, right? Or let's say um death, dead or alive, present or absent, smoker and non-smoker. For example, if smoking is an outcome, so it will come under the category of dichotomous. Either the person will be smoking or the person will be a non-smoker. Or sorry, either the person will be a smoker or he'll be a non-smoker. We don't have any ranging between the smokers and non-smokers. Got it? So it is dichotomous value or variable. This thing will be further clarified in the extraction once you people are like practicing the extraction, so further it will be cleared that what are dichotomous and the continuous variable. So for now, just remember that dichotomous variable has only two possibilities. What is continuous variables? Continuous variable is a variable that can take an infinite number of values between any two values. For example, it is measurable and typically represents things that can be measured with precisions. So simply continuous variables have a range of values. For example, if I am saying height is a continuous variable. I can have height from 1 to lakhs and millions, right? Like values. Weight is a continuous variable. I have a ranges in weights. Time is a continuous variable. I have like I don't have only two values for time. I can't say I have time or I have no time. There are like different values. It's 12 a.m., it's 1 a.m., it's 2 a.m. So it's a continuous variable. It have infinite numbers. Temperature is a continuous variable. If I am saying diabetes, so yeah, diabetes can come under the continuous variable thing, like different, sorry, not diabetes. Either the person will be having diabetes or he may not be having diabetes. If I'm saying the blood glucose level, now blood glucose level is a continuous variable. I have ranges for blood glucose level. If I am saying blood pressure have different values. If I am saying if I'm saying coronary heart disease, now coronary heart disease don't have any values. Either the person will be having heart disease or the person won't be having heart disease. Yeah, that's classification that heart disease like severe, mild, moderate. It's like another thing. But here I'm talking that if if something can take a range of numbers, simply it's a continuous variable. If there are two possibilities, there it is dichotomous variable. Got it? Dichotomous mean two. Continuous mean no limit. It's like a continuous string. Now, few other terminologies, and then we will moving on towards our extraction thing. If we are supposed to do data extraction of dichotomous variables. So in meta-analysis, data for dichotomous outcomes or dichotomous variables is extracted as number of events and totals. Okay, so in simple words, whenever we have dichotomous variables, it will be extracted in the form of events and totals. Remember this, events and totals is for dichotomous variables. For example, I am saying all cause death. Let's say I am assessing this clopidogrel with efficacy and safety of clopidogrel versus aspirin in let's say venous thromboembolism patients. So all cause death is outcome in that particular study or that particular meta-analysis. So now I'll extract that this death in events, in dichotomous form, events and totals. I'll be having, let's say, now what this 150 and 2431 means. For now, just forget about this thing. Just focus on this. It means that we had total of 2431 patients, and out of these total patients, 150 patients encountered all cause death, or like 150 patients died in the clopidogrel group. Now wait. Okay. Now if I say about this aspirin, we had a total of 2,286 patients, and out of these patients, 136 patients died in the aspirin group. 136 patients died, basically 2,286 patients were taking aspirin, and 136 died. So, total refer to the total patient population in that particular group, and events refer to that particular, like how many patients that particular outcome referred. Event doesn't refer to like the number of outcomes. It refers to the number of patients in whom that particular outcome occurred. Okay, So 136 means 136 patient died. So in dichotomous variables are extracted in the form of events and totals. For now, just like okay. Oh, wait, I guess I missed one thing in it. No, no, okay, I have covered it. So dichotomous variables are extracted in the form of events and totals, and like in the next section, you will be taught about the data analysis thing. So once we are analyzing dichotomous variables, just remember for now, dichotomous variables are analyzed in the form of risk ratios, odds ratios, risk difference, or hazards ratios. Risk ratio, odds ratio, hazards ratio. But remember this. Dichotomous variables are analyzed in this, and these are risk ratio, odds ratio, risk difference, hazards ratio. It refers to the effect size. Once you people are done with the analysis, it would be like really easy for you people to understand this thing. But for now, just like remember this, that risk ratio, odds ratio, and hazard ratio is for dichotomous variables. Okay, now continuous variables. Once we are talking about continuous variables, and in meta-analysis, when we are extracting continuous variables, so basically continuous variables are extracted in the form of mean and standard deviation. Mean and standard deviation is used for the extraction of continuous variables. For example, I can't like explain this thing in words now, but continuous variables are extracted in the form of mean and standard deviation. Just remember this thing. And mean and standard deviation can be in other forms. These values can be given in the form of median in interquartile range. Like there are different terms for this now. Median in interquartile range, median difference, or let's say, just listen to me. The first thing is mean and standard deviation. The other possibility is median in and interquartile range. The next possibility is mean difference and standard deviation. The fourth possibility is mean and standard error. Instead of standard deviation, they would have written as standard error. But we are supposed to convert all these different terminologies to mean and standard deviation, and I'll be showing you how to convert these different things to just this mean and standard deviation, because continuous variables are extracted only in the form of mean and standard deviation. And how we will convert these all other stuff, like if the continuous variable data is given in the form of median and range, or median and interquartile range, or median and standard error. So basically, guys, give me just 1 minute. Okay, so what I was saying, we are supposed to convert all this stuff to mean and standard deviation using meta converter. So up till now, these terminologies are clear. We have only 9 minutes remaining. So let me know that, is it clear? Guys,
Yes.
answer me.
Yes, it is clear.
Okay. Now in these 9 minutes, I don't know is the meeting recording or not, but I hope it's recording. Okay. So now, if I come to data extraction, how will I extract data? The first thing is, for data extraction, I'll open a Google Sheet. Okay, before that, make sure once you are extracting data for a particular variables, all these things are variables, all the stuff, all the outcomes and baseline things, we just call them variables. We will only report variables in our outcomes in our data extraction sheet only if the variables are given in either 2 or 3, or mostly we take 3 articles. For example, I'll only write age in my extraction sheet if it is written or it is reported in 3 articles. I'll put this race in my extraction sheet if it is reported in 3 articles. I'll report all the outcomes and baseline things in my extraction sheet if only these things are reported in at least 3 articles, right? Now what I'll do, I'll go to my extraction sheet, Google Sheet, or you people can like take What shall I do now? Okay. If I open my Google Sheet, or before this, just focus on this sheet. This is extraction sheet for my study, right? In extraction sheet we have different things. We have study characteristics and baseline characteristics. See, patient demographics is a baseline characteristic. So under extraction sheet we are having only we are having two sections, the baseline characteristic section and the outcome section. See, in this extraction sheet, they have reported outcomes in different like sheets, but you people will be extracting in the same sheet. I'll report all these outcome in the same sheet. In hospital, mortality is outcome, blood transfusion is an outcome, pacemaker implantation is an outcome, hospital stay is an outcome, acute kidney injury is outcome. So all this is all these are outcomes, and the first sheet is baseline sheet. This is baseline sheet. You people will be encountering only this thing. Okay, so now I open my baseline sheet. I'll go to this blank sheet. I'll open up this sheet. What I'll do, for example, I am having three studies in my meta-analysis. Let's say, um, before making you people learn the extraction sheet, let me focus on this thing. Basically, how you people will know is the outcome dichotomous or continuous? In which form the outcome is reported? Is it reported in events and totals, or is it reported in mean and standard deviation? So for this purpose, you people will have to look at the footnotes of the article, footnotes of the sheet, right? Footnotes of, sorry, the table. From there, you people will infer in which form the outcome is reported. Okay, so now if I focus on this thing, they have written numeric values are reported as n and percentage. Okay, so dichotomous variables. I told you before we extract dichotomous variables in events and totals form. But these events and total forms are for outcomes. The outcomes section you will extract as events and totals. Now, what is events and totals? I'll come to that. But in baseline sheet, you people will extract the dichotomous variables in the form of n and percentage. N refers to events, the same thing. N refers to events and percentage refers to like how much percent. Let's say now, before going to that, let me tell what is totals. Totals basically refers to sample size of a particular group. For example, in this study, they are saying we had 535 pregnancies randomized. These 535 ladies were randomized to two groups. 268 received metformin and 267 received placebo, right? Okay. So, if these 268 patients receive metformin, so it means that this 268 shall be my sample size, and 267 receive placebo, so it means that 267 is my sample size for a particular group. Or in other words, now if I focus on this thing, they are saying 268 receive metformin, then again they are saying, sorry, 268 were randomized to receive metformin and 267 randomized to receive placebo. Now they are saying 264 received metformin, and here they are saying 262 received placebo. What does it mean? Means that in this group, if 268 were randomized and 264 received, these 8 patients didn't like receive metformin. Although they were randomized to receive metformin, but they left the study. See, patients withdrew consent. So it means that they left the study, right? Again, in this thing, 267 were randomized, but 262 received placebo. It means that how many patients? 5, 4, 9, 10. 10 patients left the study. Then they have given reason that they did not receive placebo. 5 did not receive placebo as randomized. There can be any reason. I'll go into detail in or quality assessment thing. 4 patients withdrew consent. Now, what to focus is What will be your sample size? Again, because like there are too many numbers written, 268, 264, 262, 235. What does it mean? What will you write in your sample size of a particular group? So basically, that sample size will be the number with which the randomize is written. 268 receive metformin. Wait, let me go. Yeah. And here 267 didn't receive, they were randomized to receive metformin. So in simple words, your sample size shall be that number which is randomized. So you can guess your sample size of a particular group from this table, and directly you can guess from here. See, 268 were in metformin group and 267 were in placebo group. So this is basically the 268 is the totals of metformin and 267 is the totals of my placebo. Got it? Till now, is it clear?
Yes.
Okay, so we have 2 minutes remaining. I'll be creating a new meeting link and I'll be clarifying then. Okay?
Okay.
Guys, can you please tell me, can any one of you tell me how can I save my recordings? Because I have never recorded through Zoom. I record through Op Studio and I don't know how to stop this. I know how to stop this, but I don't know how to
I
save.
think it's recording.
What?
Your video is recording. It's coming on my
Okay, so I
screen.
am saying how to save this now.